Hi, it's Dr. Andy. Today I'm just going to walk you through what my regular routine is when I'm looking through data in my local area to try to figure out what risks and trends are that are going on. Now I'm in Arizona right now. Unfortunately, it's quite a hot spot, so we're going to see some interesting things as we look through my approach here. All right, so let me just show you how I run through and kind of try to keep my finger on what's going on each day with the data. So I'm in Arizona again, so I'm coming to the Arizona Department of Health Services, azDHS.gov, and what I do is I go to the data dashboard. Most states will have something like this, um, and so if I just scroll down and see what they got there, first I see there's a bunch of cases, a bunch of numbers, and then this map over on the side. To me, usually the maps and the graphs are easier, so the number may or may not be all that useful. The problem with this map, though, is, well, I mean, what do we see first? It looks like this is Maricopa County where Phoenix is, and we see tons of cases there. It looks like, wow, that's the problem. I don't want to be there, right? And that's what I'm thinking. Well, let me show you a little bit something about that. I'm going to go to the CDC now, and I'm going to show you data across the U.S. Because if you think about where the problems is, so go to data and surveillance, and I want to use the CDC COVID data tracker. So this is a similar map but as what we just looked at in Arizona, but for the whole US. And so if I look at this, I think, wow, total cases, gosh, the problem is in New York, Michigan, Texas, California. Okay, so I'm thinking those are the hot spots, right? Now, the issue, though, is that is not normalized. That is not giving me a rate. Let me change this to the rates. Now I'm actually looking at what the risk is. How many people are getting infected divided by how many people live there. And when I do that, New York is still bad. Michigan's still pretty bad, but look what happened to California and Texas. Not so bad anymore. Lots of cases there, but also lots and lots of people. So the risk, the rate of infection there is really not as bad, relatively speaking. Now, the problem with this, though, still, is this is just telling me the total count. And so while it's good that it's now normalized it by the population there, it's counted all the cases from the very beginning. And if I want to figure out where is it risky for me to be, I probably want to just know what's going on recently. So look at the cases in the last 7 days. And now I see there are lots of cases in California, lots in Texas. Arizona got added on there, a hot spot right now. But look what happened in New York and Michigan. Not as bad anymore. Still quite a few cases, but not nearly as bad. Now, let me tell you what I'd really like to see. I'd like to see cases in the last 7 days per 100,000 people. Combine these two. Then I could see what my current risk is in a particular place. Unfortunately, that's not an option here. So we have to kind of recognize what we're seeing and figure out what we can combine and how we can figure that out. Now, we can hover over each of these and see the information, but I'd really like to see it in a map. I'd like to see cases in the last 7 days per 100,000 people. Unfortunately, that's not an option here. Let's go back to Arizona. So one interesting thing with this map down here, like I said, Maricopa County looks like the really, really bad spot. Watch what happens here if I switch to rates per 100,000. Dramatic difference. Now I see that the real problem has been up here in the corner, the Navajo Nation, and down here in Yuma. Maricopa County, while there were lots of cases there, that's where most of the people in Arizona live. And so the risk isn't as bad as it is in these other areas. Still risk, certainly, still a problem, but not nearly as bad. Now, so that's just giving you the overall, but remember, one of the problems is that this, again, is just showing total count from the beginning. If I want to know what's going on now, I need to look at something else, and I'm going to show you something here, confirmed COVID-19 cases by day, that we call the epi curve. Before I do that, I just want to point this number out here, number of new cases reported today. Now, one of the problems with this number, this just says how many positive results the labs told us about on this day. More helpful is this thing called the epi curve. And that's because the epi curve shows not how many positive tests were reported on that day, but when those tests were collected. So it actually, ideally, it even shows the day that symptoms began for the person, but usually, in many cases, that data is not collected. All we have is the day that the test was collected. So the problem is that they collected this test on June 16th, but it wasn't reported until today. It's going to show up on that number that we just saw rather than the day that the test was collected. If we put it on the day the test is collected, we can see more like in real time, more as we add them on, we can see what the actual curve was going on. What the days that people were actually getting tested, which is more likely the days they were getting infected. And so if we look at that rather than just the case counts, we get a better idea of how this epidemic has grown. It is a little bit in retrospect. I said real time before. That I meant the opposite. When real time we get the case counts. But this is a retrospective look back of a few days. And that's why these last few days we don't have any case counts yet. And so you have to understand when you're looking at this that you don't really have accurate numbers until you're about a week out. Unfortunately, accurate numbers to give you this graph. You can know how many cases were reported that day, but to put them back on an epi curve and to see how the pandemic was actually growing and shaping, you need to wait a few days. In fact, I want to compare, this was from yesterday morning, this is what this graph looked like. So you see this peak here, 2,777, for example, 2 reporting periods later, that's 2,889. So there were still over 100 cases that were collected that day that hadn't been reported. Maybe the lab hadn't got through it yet, or they just hadn't been collected at the state yet. Lately, I've been seeing more of a delay in getting those labs done, and I think it's just because the labs are getting backed up. This one here, for example, 3,086, when I looked at that earlier today, before they had added the new data from today, it was 3,011. So there are 77 or 75 more cases that got added there. So the point there is that here, if we were looking back here, we might have said, oh, it looks like it peaked already. But by now we see, nope, it hadn't peaked. And it still may not have, because we're probably still going to add tests that were collected this day. We definitely will have more collected this day, definitely more this day. So unfortunately, this looks like it may very well still be growing in Arizona. Now, some people have been talking about, well, if we're getting more positive tests, it's just because we're testing more. One thing that we look at to decide if that could be true is the percent of positive tests. And so the gray here, the gray bar shows how many tests were done each of these weeks. This is the total in a certain week. And that red dot shows how many of them were positive. So in this case, we were doing more and more and more tests as time went on here. But unfortunately, even a higher percentage of those tests were also being positive. So that definitely is a sign that this is growing, not just that we're testing more. So that's another thing I look at. And then finally, just a couple more things that I look at here, the deaths. Now, deaths obviously are what we're really trying to avoid. And usually deaths are going to follow the cases by at least a couple weeks, if not 3 or 4 weeks. So that's one of the issues here, is if it looks like things are going down, which a couple weeks ago, that's what it looked like. Now, unfortunately, we're starting just to see some of these death numbers go up, and it looks like this is probably going to start to climb, similar to what we saw in that epi curve that showed us about the cases climbing. Now, unfortunately, that's my fear, is that we're now going to start to see more deaths show up here, and that what we thought we had kind of got over the hump and had started to come down, it's going to turn out that that's not the case. One other thing this in Arizona that we're paying close attention to is ICU bed availability, and that has been shrinking. There are still contingency spots that can be opened, and they have contingency plans to open up more beds, but that's problematic. Emergency department usage gone up a little bit. That usually stays fairly constant because they move people out of there, right? People come into the emergency department, but then they move them on. But the inpatient bed usage, we're going to see also that percentages of available beds is shrinking, unfortunately. So those are the kind of numbers that I look at to get a picture of what's going on, and see where things are now as we move on through this pandemic. So that's it. Again, I'm Dr. Andy, trying to make the world a better place by teaching you public health.